Today on Town Hall.
AI is not in the future. The AI is here. The AI is here with us right now. There's a term at Amazon called undifferentiated heavy lifting work, repetitive, no value work. If we could use AI to help freeing our resources, they could spend more time with our patients and improve patient outcome.
My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Town Hall show is designed to bring insights from practitioners and leaders on the front lines of healthcare. All right, let's jump right into today's episode.
Hello, everyone, and welcome to Town Hall, a production of This Week Health and Al's AI Insights podcast. I'm your host, Dr. Al Valera. For this session, I'm honored to be joined by a collaborative clinical and vendor group using AI to solve very important patient care scenarios. Let me introduce you to the team. Christina Silvers, who's a healthcare executive advisor with Amazon, Dr. Christine Silvers. Dr. Praveen Meka, who's a hospitalist from Dana-Farber and instructor of medicine, Harvard Medical School. And Qing Liu, who's senior solutions architect and healthcare for Amazon Web Services. It's an honor to have you all on the show. Thank you very much for attending. Please go ahead and introduce yourselves further.
Al, thank you so much for inviting us to your show. My name is Chris Silvers, and as you said, I serve as healthcare executive advisor with Amazon Web Services. And during my 25 years prior to joining AWS, I spent my time as a researcher in artificial intelligence, as an emergency physician caring for patients, and as chief medical officer at two healthcare technology startups. My AI work originally focused on improving bedside alerts in the hospital intensive care units, which was a collaboration with MIT, Harvard Medical School, and Boston Children's Hospital. Currently, my AI interests are broader, really encompassing any areas that our healthcare customers are interested in pursuing, all to ultimately improve patient care.
That's great. Dr. Meka.
Thank you, Al. Thank you, everyone, for having me here. To introduce myself, I'm Praveen Meka. I'm currently a physician at Dana-Farber Cancer Institute. This is a hospital based in Boston. It's a cancer hospital. I've been a clinician in all for 15 years now in varying positions and institutions. I am currently a hospitalist, so that means I take care of patients admitted to the hospital. And apart from my clinical work, I also love to work on digital health technologies. One of the things I'm working on is called ConsultBot that helps interpret blood tests, especially the blood gas, using a language model.
Excellent. Qing, welcome.
Hi, Al. Thanks for inviting us. My name is Qing Liu. I am a solutions architect here at AWS. I have a passion in using technology to help clinicians as well as improve patient outcomes. So I had the privilege working with Dr. Meka and Dr. Silvers on creating this consult bot. So I'm very excited to share what we have achieved today.
We're honored to have you. We're excited to have you discuss it as well. So what are some of the most promising applications in AI in healthcare today, if you see it from your perspective, and how do you see them transforming patient care in our near term and in our future?
Al, there are just so many possibilities. I would love to just share a whole bunch of examples in the context of a fictitious patient scenario to make it easier to remember, if you don't mind if we start
Please
there.
do. That'd be great.
So let's say our patient has a newly diagnosed, likely lung cancer, seen while getting a chest x-ray. So our patient needs to be referred to oncology. AI can help auto-generate the referral letter. At the same time, the patient gets automatically invited to join an AI-powered personalized cancer care app for navigating their care. And this app provides the patient with features like relevant educational snippets in the patient's native language and at their literacy level, streamlined self-scheduling for doctor's appointments, and a support community with other patients and families. Meanwhile, the oncology department starts receiving many fax PDFs of the patient records. AI can do intelligent document processing to group these documents and convert them using an electronic format. The oncologist then has AI review these records to provide a summary so the patient can skip having to fill out those history forms in the waiting room on the clipboard. And AI can be used for ambient listening of the patient-provider conversation to then draft the clinical note for the electronic health record. This not only saves time for the provider, but also improves the experience for both the patient and the provider. Then let's say the oncologist orders a chest CT scan. AI can do automated interpretation of the scan images and uses these results along with EHR data to help the oncologist decide on the treatment. And AI can automatically code the encounter to bill for reimbursement and fill out prior authorization paperwork required for the medication. Then let's say things go really smoothly for several weeks on this special medication, but one day the patient becomes really short of breath and they call 911. The emergency room doctor does a number of tests, including what's called an arterial blood gas that Praveen mentioned. And these results can be really confusing to understand. So AI helps with interpretation, which is critical to make the correct diagnosis and guide correct treatment. The ER doctor then admits the patient to the hospital. AI can be used to check that the medications and procedures ordered make sense, given the patient's age, weight, kidney function, and so forth. And when the patient improves, let's say the patient gets discharged to home with a blood pressure cuff and a pulse oximeter, AI can monitor these vital signs at home to look for any concerning trends. Now, clearly, I made this scenario up, but it's to illustrate that there are many ways in which AI can potentially help us in healthcare.
Do we have currently an opportunity to facilitate any of what you said just now around patient care?
Oh, definitely. There are already a lot of these that have been created: ambient listening, automated coding, multimodal analysis, and so forth. And for those that don't already exist, they can be implemented using AWS's existing technology building blocks. In fact, I think Praveen can describe one of these innovations that he's built using these building blocks.
Thank you, Chris. Yeah, I'd love to talk a little bit more about ConsultBot. So this is a tool that helps interpret blood tests, a specific blood test called a blood gas. So blood gas, a little bit background about blood gas for those of us in the audience who may not realize what that is. It's a little more complicated blood test than you'd get in the clinic. It's usually done on the inpatient side. So as a clinician at the hospital, I use it mostly to triage patients, especially patients who seem to be clinically decompensating. And the problem with this blood test is, one, it's of course done in a more acute setting. Then two, it can take a complex blood test, like it has a variation amount of complexity. A more complex blood gas with a triple acid-based problem could take 5 to 10 minutes to interpret for a clinician. And finally, when it gets up to a triple acid-based problem or even double acid-based problem, the risk of clinical misinterpretation by a physician goes up too. Like, for example, I was reading somewhere it's as high as 70% if there's a triple acid-based problem for misinterpretation. So having a tool that does that for you would be very helpful. And that's why we start to work on it to begin with. There are 3 components to a blood gas usually, but they could, of course, be more. One is a pH, one is a CO2 level, one is a bicarbonate. A normal pH, if you go back to school, would be like 7, but for human body, 7.4. So anything lower than that, it's acidic, and higher than that, alkalotic. And it's a complex interplay between the lungs and the kidney that pulls the acid base in one direction or the other. So you can get more answers just by looking at a blood gas. For example, recently I was taking care of a patient on the floor, and he was starting to breathe twice, so I knew something was not right. So the first question is, okay, what do we need to do about his breathing, and does he need to be in the ICU? So I ordered blood gas. That gives me an idea of how to triage a patient. In this case, there seemed to be respiratory failure. That's the term we use when the breathing is not very good, and we got to decide, does the patient need additional respiratory support? So you put him on a little bit like a BiPAP. It's a partial support that we could do on the floor. And we checked the blood gas again and in 30 to 30 minutes to an hour. And we found it actually got worse. And on top of it, there was something known as lactic acidosis that points towards worsening sepsis. So that's another life-threatening condition. In the end, the patient ended up going to the ICU, but I just wanted to give you an idea of the importance of a blood test, like a blood gas that we use to triage and appropriately put the patient in the right bucket. By that I mean like a right floor. So yeah, that's basically a little snapshot about a blood gas. And now what we built, a ConsultBot, is a tool that is a combination of language models. So we leverage language models. And we have a little decision architecture that involves hard-coded rules. Like, for example, I said if the pH is less than this is acidic, pH less than that is higher than that is alkalotic. So we have a little more hard-coded rules in addition to something we use known as RAG architecture. So that's also stands for retrieval augmented generation. So what that means is when you ask a question of a language model, to be able to get a more accurate answer, it goes to a knowledge base and gets a chunk of text that helps answer that question. So its answer is more detailed and more specific. So creating that, we created console bot. And in the most recent iteration, we had an accuracy of 98% on a sample of 100 blood tests. So we gave the language model, like the bot 100 tests to interpret, and 98% were accurate. We, of course, need to validate it a little bit more on real clinical data, but this is the preliminary data that is very encouraging.
It's fascinating, Praveen. Is the access to the technology within your EMR? Does it work within that dropdown, or do you have it portable, or I guess both within the EMR and in your devices as well?
So as of now, it needs more clinical validation. So we have it like an app, like a web app. You go to that, you can start entering the blood test, and you get an answer. In the future, once it's clinically validated, we will work on integrating it in the EMR, so the clinician does not have to enter each and every value. As you mentioned, there are like several values, like sometimes it can be as high as 5 to 7 values you have to enter in. So if it could do it automatically, that would be great. So once we know it works well on clinical real patient data, then we'll look at the next step at integrating it.
It's fascinating because I remember as a fellow emergency physician, I've always had that one little nugget in the back of my head. I got to figure this out. And how do we do this? And you sit by yourself in the corner and try to do the math on figuring out metabolic, acidotic, et cetera. So wonderful work. Thank you so much for really solving a problem that one is very important to get it right every single time for the patient, but also needs to be done in a timely manner. And both are being done through AI. So fascinating collaborative work there as well. Improving diagnostic accuracy and speed through AI. Are you any success stories around those besides what you just presented as well?
Yeah, I have an example that I really like. In 2020, in just 10 days, researchers at UC San Diego Health with AWS's assistance were able to put an algorithm for detecting pneumonia in chest x-rays into use in the clinical workflow. It was incredibly helpful for diagnosing patients with COVID, and they processed over 400 x-rays on the first day and 65,000 x-rays in the first 6 months. And moreover, their AI solution impacted the clinical decision-making about 20% of the time. And another example in terms of improving diagnostic accuracy, GE Healthcare wanted to embrace machine learning to drive improved patient outcomes. So they collaborated with clinicians at UC San Francisco to create a library of deep learning algorithms for improving imaging technologies like ultrasounds and CT scans. And they incorporate data like patient-reported data, sensor data, and other sources into their scan process to help in distinguishing between normal and abnormal results. And thus far, 82% of their healthcare decision makers surveyed say that the use of data is already resulting in improved patient care, and 63% report lower readmission rates.
This is the dawn of penicillin being introduced to healthcare years and years ago. We're actually helping patients now, not just watching them suffer from sepsis. So moving along, AI has really come a long way to helping us drive better care for accuracy. But understandingly, it isn't just clinical. It isn't just informatics. I know there's a whole technical evaluation that's done. And Qing, you can talk about that. I mean, what kind of considerations do we bring in when we're implementing AI into healthcare, especially around security, cloud-based, and data privacy?
Yeah, of course. Because we're in healthcare, security is always on top of our mind, right? We need to safeguard the patient data. And in the United States, this means that we need to protect the patient data according to HIPAA requirements. At AWS, we have a list of HIPAA eligible services, which means that as a customer, you can use any of these services to process and store PHI data in a secure way. For example, one of the AWS services that Dr. Meka has used in his solution is called Amazon Bedrock. And Amazon Bedrock is one of the HIPAA eligible services that we can leverage for bringing generative AI into your application. So, and there are a number of things you need to know in terms of the security aspects of Amazon Bedrock. First is none of the customer data is used to train the underlying model or shared with the model providers. And secondly, all the data is encrypted in both at rest as well as in transit. And the third thing is from the data sovereignty perspective, the data stays in the region that you specify. So it's not copied to other regions or locations without your awareness. And not only Bedrock is HIPAA eligible, it also meets other compliance program requirements such as GDPR, SOC, ISO, and so on. And the last thing I would say is that implementing AI in healthcare is no different than implementing other healthcare applications. You still need to worry about data access control. So the data is only accessed by authorized users and with patient consent. And you should also think about how do we enable patients to maintain control over their data. So they should be able to opt out if they would like to.
So you're on a roll. I'm curious, just like implementing anything new in life, people have to gain trust in that. Where do you see the limitations and let's just say the challenges that you've supported from a clinical perspective, the clinicians using your design, your technology, and gaining that trust with them, as well as we all create the trust with the patient? How do you bring all that together?
Yeah, so we do face a lot of challenges, and I would also like to share how we are addressing those challenges as we are working together with our customers. So I think we already touched about security, right? So it's always everybody's concern. How do we leverage generative AI or other AI technologies in a secure way without exposing patient data or any organization-sensitive data? So we have AWS services and open solutions to help our customers set up that secure infrastructure. So I think another challenge or another common question people ask is, how do we get started? Do I need AI skills? And that's where Amazon Bedrock service comes in, right? The service is designed to democratizing access to cutting edge foundation models as well as large language models to provide easy access to a wide range of foundation models in a secure way. Right? One of the probably easiest way to get quickly started using generative AI is by logging into AWS console and start using the playground feature, and you can start experimenting with different large language models and see how it performs with your particular use case. And I think one of the common phrase we hear in the field of generative AI is hallucination, right? So it means the generative AI is making incorrect and false statements, but these statements are presented in a way that sounds very factual. And because of the nature of generative AI, this is not something we can get rid of it completely. But there have been techniques that we are leveraging to reduce the hallucination. For example, the retrieval augmented generation that Dr. Meka mentioned is a common approach to bring additional context to the large language model so it can generate a more accurate response. There are some other techniques such as chain of thoughts you can adopt in your prompt to kind of guide the large language model to come to the right conclusion. And it is a rapidly evolving field. So I think we're going to see more and more interesting approaches in the future to find different ways to improve the performance of large language models. And I think the last thing I want to mention is that when people are thinking about building generative AI applications or bring generative AI capabilities into your existing workflow, one thing to think about is how do you protect that generative AI application, especially from undesirable content. What I mean by that is there could be topics that you would like to avoid. For example, if you're building a generative AI powered patient appointment booking chatbot, you probably don't want this chatbot start giving out medical advices, right? So that's a topic that you would like the generative AI to avoid discussing with the patient. There could be harmful content such as violent, hate speech, and so on, and you would like to filter those out. And there are some interesting ways to break generative AI called prompt attack or prompt injection, which is a way to kind of trick the generative AI to do something that's not supposed to do. So how do you kind of safeguard your application against all these different undesirable content? We have tools such as Amazon Bedrock guardrails that you can leverage, that you can kind of create this layer of protection around your generative AI applications so that you can safeguard your application against those contents that you want to avoid.
So you create an incredible environment that we can practice medicine in safely and ultimately take care of the patient. So looking at the future or near future as we see it today, personalizing that medicine, how do we personalize it for the patient? So no longer the patient have to talk to one of us to get information and go to the next step, whether it be creating a call for an appointment or getting advice on medications or giving just some challenge questions to say, hey, how do I do something with my new albuterol inhaler I received? Those kind of questions don't need us anymore. They can use AI. That's personalizing the medicine. Just like we're personalizing shopping on Amazon itself, we're personalizing the same experience, I believe, which is wonderful, in the same understanding that we're here for the patient will benefit. When you do so, how does that enhance through AI, Christine, your treatment plans, your patient outcomes? Is there better satisfaction? What have you seen from that aspect?
Yeah, well, there's a lot of different ways in which we can personalize medicine, both in coming up with diagnoses, figuring out optimal treatments, or in educating the patients. For example, AI can be used to analyze the patient's individualized results, such as from the EHR and their genomic data. And then, in conjunction with the published research, that helps the providers figure out what their diagnosis is. Like the Undiagnosed Diseases Network can help patients with symptoms of unknown origin. Or which treatments might be more effective for a particular patient might depend on their particular biomarkers, like in the case of breast cancer or lung cancer. A different example is in personalizing medicine is with the clinical practice guidelines, which I'm sure you remember that or are familiar that these are often hundreds of pages long and updated every year or every few years. And there are guidelines for heart failure, for diabetes, for chronic kidney disease, and so forth. And it makes it really difficult for providers to keep up. This AI can help providers identify which specific individuals are aligned with which particular practice guideline recommendations. And one of the startups that I previously worked at, in fact, focused on creating these algorithms. I'll just give an example on personalizing education. The T1D Learning Camp game is an application created in collaboration with Harvard Medical School, which uses generative AI to personalize the conversations that teach children with type 1 diabetes how the specific foods that they say they're eating will then affect their blood sugar. And it's all in a game format. So all of these ways are personalizing treatments and education that can hopefully then improve the patient outcomes.
That's just terrific. I think AI has come a long way in terms of really communicating and joining the patient outcomes with our technology to allow a collaboration to care rather than a one-way informative process where the patient now has more information they ever can imagine, but also has now ability to ask questions and get the answers immediately through the AI component. That's one patient. Let's talk about hundreds of patients. Let's talk about medical research. Where's medical research, drug discovery, and new therapies coming through the advancement of utilizing AI within the research realm?
So recently, I was reading like the Nobel Prize in Chemistry was for AI modeling of protein folding. And apparently the program these two researchers created, it was called, I think, AlphaFold, was able to predict protein folding in 200 million instances. So that's a huge mind-boggling number. And such protein folding can be used for identifying protein to figure out which drug to make, what the target should be, or to predict antibiotic resistance. So in a lot of healthcare applications. So the fact that they were recognized at that scale tells me AI is already widely being used. AI in general, like we focus on language models, but there's also the traditional AI previous to language models came up. So it's been ongoing for a while. I'll let Chris weigh in too.
Chris, go ahead.
Yeah, and besides the drug discovery area, AI can analyze data from the patient's records and match them to clinical trials to increase enrollment and potentially the diversity in the studies. So one example is this company called Thread. They've developed a cloud-based platform for running decentralized clinical trials, and they estimate that they can support up to 5 times more inclusive enrollment compared to the industry benchmarks. And then another example is it sort of gets back to the clinical practice guidelines I was just mentioning is the People Heart Study out of Harvard Medical School. This is a research study interested in understanding how data can empower individuals to evaluate their own heart health. And it's trying to look at whether individuals who gain digital access to their lab tests and their medical history from their care providers can then produce personalized heart health recommendations based on the current guidelines from the American College of Cardiology and the American Heart Association for the prevention of heart disease. And then Praveen mentioned the work with the Nobel Prize. Pfizer is another example working with AWS. They're using generative AI to help identify new oncology targets. There's previously a manual process to aggregate the information, but now AI can help to identify and collate the relevant data and speed the whole process and improve the probability of their success.
That's terrific. I think we have a new tool that we all have to learn how to use appropriately and to its extent. There's little spears going in and out. This group has created a very strong spirit to clinical outcomes and understanding how to utilize it for patient individual care, but also for research. But we know technology is only as good as access to that technology. So where do you see AI working around the underserved and remote areas in healthcare? Do we use telehealth around that? How does this work for those patients who cannot get to you, but you need to get to them through AI?
There's one example I like to share. So this is actually a project we collaborated with New South Wales in Australia. It's a government entity called Telestroke Service. So this was probably a couple of years ago, using deep learning AI to bring AI to medical imaging. So what we have done here is we created a virtual platform that uses AI to identify types of stroke. So whether it's ischemic or hemorrhagic based on brain CT scans. So the AI can also annotate the images further by segmentation. And there are 2 major benefits that this AI-assisted telestroke service brings. First is this AI-assisted labeling of medical images can greatly reduce the time required for manual labeling. Right? It provides clinician with useful data at the time of patient management. The second benefit is that because it's a virtual platform, it enables staff in remote areas access to a network of specialists, so helping to save lives and improve patient outcomes.
Terrific. Any other examples of utilizing this for remote access to care?
Yeah, I have an example. As part of AWS's $60 million commitment to improving health equity, we provided resources to a startup called Huron AI to help build and scale AI-powered applications that enable oncologists to provide remote patient monitoring and tele-oncology care. So they offer their solutions to patients in Nigeria, Kenya, and Rwanda. If you take Rwanda as an example, there are fewer than 15 oncologists for a population of 13.5 million people. And Huron AI created a digital application that allows doctors and patients to communicate frequently and easily through auto-generated text message prompts about symptoms and side effects. And so their work is increasing the ability to provide care to more patients in more places.
So the utilization of this technology is fantastic. It is available to everyone, but not everyone has mastered it. So how do we close that gap in terms of what you can do and what I can understand is the goal here, but a majority of people are asking for it, but don't know how to get started. How do you close that gap to really bring them along in terms of technology at the bedside and in their clinical practice?
So on the medical school that we associate with, the Harvard Medical School, the students are already encouraged to use language models to get a feel of it. Because we know the patient's already starting to use it. So you might as well learn how to use it too. And simultaneously, I think clinicians are still very skeptical about using language models. I think creating more opportunity for clinician industry collaboration or clinicians having a more say in how language models are developed as they're used within healthcare, or even like there have also been some concerns flagged around ethical AI. So if the training data was created in such a way that was free of bias and made it more equitable, I think that would help people get more on board. Then more testing before we, like even my project, before we roll out to clinicians to use on ground, we have to, of course, test it and vet it. In that process, we need more clarity by the regulators too. Like when you have AI being part of the workflow of a clinician, of course, question about HIPAA and privacy. And let's say just a question like if the language model gets updated, which they are every few months, how does that affect the FDA approval? So I think there are several steps we need to take as all the stakeholders have to take before we get to the stage where everybody's using AI.
Qing, you're the expert on technology here. How do we learn what's inside there and utilize it for our patients?
Yeah, so I like to mention about an Amazon initiative called AI Ready. The goal of this initiative is to provide free AI skill training to 2 million people by 2025, which is this year. So what we have been doing is creating a lot of resources and making AI education accessible by providing those training resources to people, including healthcare professionals who want to learn about this new technology. And one of the resources that I like to share today is called AWS Skill Builder, and the website is skillbuilder.aws. So this is an online learning center where you can learn a lot of not only AWS, but AI technologies for free or at a very low cost. And it's geared towards both non-technical and technical audiences. So I would like you to try it out. It's free to register. And again, the website is skillbuilder.aws.
That's fantastic. Well, first of all, thank you for having Amazon and be able to help the clinical world understand your expertise, and all of you has been there a tremendously valuable platform to get initiated, but also to grow with in terms of as your advancements grow, as your expertise grows, as your experiences grow, so does the advancements of patient care. Moving ahead, where do we go here 2 years from now, 5 years from now? Where will AI be in terms of our clinical practice? And where do you think are the best areas in healthcare that will be advancements be made in the future of healthcare itself?
Well, I could say AI permeate every aspect of healthcare. It does not mean if the ability for it to permeate would lead to it being like if I were to see it from a patient's view, like I use devices all the time to manage my health. So I could see AI being a big part of device monitoring, even behavior modification, like people are trying to lose weight or quit smoking. I think AI could be a big part of that too. Then alerting before issues become critical using on-device monitoring. Let's say if you have an AFib you didn't realize you had, your watch could tell you. I think it's already in play. I think in the future, more conditions could be monitored. And also, as Qing had mentioned about scheduling appointments, once you have agents like AI agents that could do it, make it very easy to look through and find an appointment that works for you. And even preparing for appointments, when you're going to see your doctor, what questions to ask. And follow-ups, of course, keep your scheduled follow-ups with your doctors. That's the way I see it from a patient's point of view, like it could affect every aspect of healthcare. From a clinician's perspective, like I'm a clinician, I try to think about in my daily day, I could see AI help in every aspect. Like, for example, burnout is a big concern by clinicians. Anything that can help with burnout, documentation, or coding, because another thing to do, like AI can help do that for you. Then research and education, it's already playing a big role over there. I think both Chris and Qing talked about how AI is contributing big time to research and faster drug development. And also for clinicians, as part of burnout, the tool I'm working on, it addresses a cognitive workload. Like when you're busy at work, you already have the pagers going off, documentation, and then the labs can sometimes have like hidden things that you can overlook. So having a tool, a clinical adjunct that helps you manage your cognitive workload would actually be pretty helpful too. So that's the reason I came up with Consult Bot. So it's like a decision support, like your sidekick who's helping you manage your daily tasks. And also errors. Errors are a big part in healthcare that adds to a lot of cost. So having tools that can help reduce errors, it could be pretty helpful over there too. And finally, there was this thing I was reading about in-basket management, because a lot of primary care doctors getting burned out from in-basket management. So having AI help you with that would be very helpful too. If it's okay, I would like to demo my tool at this time and show how it would help a clinician interpret blood tests.
That'd be great. Thanks, Praveen. Go ahead.
So I'll put in like a couple of blood gases, which I have a layer of complexity to them, and then we'll see how Consult Bot interprets them. So let's say the pH is 7.36, PCO2 is 44, bicarb is 24. So they're all within range. The only wrinkle is an iron gap is elevated. So sometimes this can slip through that when if you look at the initial three and like, oh, the blood gas is normal, but an iron gap isn't. So this is actually a complicated blood gas with a layer of complexity to it. So what the tool is doing at the back, it goes through a hard-coded bunch of rules, takes a chunk of text from a knowledge base and sends it to the language model. So this tells us there's high anion gap metabolic acidosis with mixed metabolic alkalosis. It's actually pretty common if someone has, like in this case, a diabetic ketoacidosis, so they're acidotic due to anion gap acidosis, but they're also throwing up, vomiting a lot, so that actually leads to metabolic alkalosis. It's actually more complicated than what it looks when you see the blood test initially. Let me give you another example. Let's say this patient is really sick. pH is 7.05, so that means patient is pretty acidotic. PCO2 is 50. Bicarb is 15. And in this case, we have an oxygen PO2, that's 180, so we know the patient getting a lot of oxygen. And FiO2 is 0.4. So this is a more complicated blood test that we would see during a code, like code blue. Let's say pH is 7.05, PCO2 is 40, we have bicarb at 15. I just want to make sure I got all the anion gap. Let me take that out. That was in the last one. PO2 is elevated, so that's higher than usual. Let's go through with this. Yeah, so as of now, in the back, it's going through an algorithm with hard-coded rules and sending it to the language model. And this is what we get: uncompensated mixed acidosis. It tells you like there's probably multi-organ involvement, metabolic acidosis, possibly renal loss of respiratory acidosis, hypercapnic respiratory failure. And on top of it, if you see the PF ratio here, which we have to calculate, usually clinicians can sometimes forget to see if the patient with ARDS, it calculates for you. So it tells you at FiO2 of 0.4, like 40%, oxygen level of 180 is actually normal. Yeah, so that's all I have to share for this. I'll refer to Qing.
That's fantastic. Wish we all had that back in 2005, right? And we're in emergency departments as well. That's terrific, Praveen. Qing, anything from yourself in terms of the future, and what do you, from a technical perspective, want to create for healthcare?
Yeah, I think Praveen covered pretty well. From my point of view, I would like to see more and more of such sidekick applications in the near future. The AI is not in the future. The AI is here. The AI is here with us right now. And there are a lot of things we can do with the help of AI, especially there's a term at Amazon called undifferentiated heavy lifting work. So that's what we mean by repetitive, no value work that we see our clinicians and providers spend a lot of time doing. So if we could use AI to help freeing our resources, spending time on those types of work, they could spend more time with our patients and improve patient outcome. That's what I would like to see more in the near future.
In the very near future, I'm sure you've got a roadmap for this week. Christine, anything last words from yourself?
Yeah, I agree with both what Praveen and Qing shared. I think AI and other innovative technologies will further empower both patients and clinicians with the information that we need to make better and safer decisions. And with these continued advancements, I think we'll make much more progress towards that quadruple aim, really to improve patient outcomes and improve the experience for both patients and providers, while also decreasing healthcare costs and doing all of that in an equitable way.
Excellent points. Thank you very much. Christine, Praveen, Qing, it's an honor to have you participate in today's AI healthcare discussion. And how are you using clinical evidence and clinical experience and technical design around artificial intelligence to really enhance the current state? There's no longer future. We're here. We're living the innovative current world that healthcare is evolving from. So I want to appreciate all your time here today. And we'll have this video available to everyone shortly on the web and through, and we'll share it with you all as well. Thank you all for joining us today. We look forward to seeing you next month's Town Hall by This Week Health and Al's AI Insights.
Thanks for listening to this week's Town Hall. A big thanks to our hosts and content creators. We really couldn't do it without them. We hope that you're going to share this podcast with a peer or a friend. It's a great chance to discuss and even establish a mentoring relationship along the way. One way you can support the show is to subscribe and leave us a rating. That would be really appreciated. Check them out at thisweekhealth.com/partners. Thanks for listening. That's all for now.